Expired. Senator Di Natale.
Thank you, Mr Acting Deputy President. I'm very proud to rise to speak to this bill today. It's a bill that is the first step in a major reform of dental health in this country. It represents a huge investment, one that will pay handsome dividends in the coming years, and it's an outcome in which the Greens played a critical role, a package that will make a real difference in the lives of most Australians. We are very lucky in this country to have a good healthcare system. Good health's a fundamental part of a happy and fulfilled life, and we can take comfort in the knowledge that we do live in a country where if we get sick, help will be available. There is room for improvement. We can do a lot better than we're currently doing in some areas of our healthcare sector, but we can take comfort in the fact that we can get help from common illnesses when we need it, and we can do that without the threat of bankruptcy or a threat to our financial security. There is one exception to that, though, and that is if you have a problem with your mouth. For some reason, we treat the mouth separately from the rest of the body, and there's no good medical reason for this. The mouth's connected to the same circulatory and nervous system as every other part of the body. An oral infection can spread just as easily as any other kind of infection. The experience of pain is the same. Ultimately, poor oral health is a medical issue. The fact that dental care is not part of Medicare is purely a historical accident, and as a consequence we've seen decades of neglect in this area. The public health situation regarding oral health isn't a rosy one, and in some areas it's actually getting worse. We've made some improvements in oral health. Fluoridation, for example, better nutrition and technical progress in areas of dentistry mean that people do have more teeth now than they would have had during our grandparents' generation. That's all good news. The bad news is that the oral health of some young kids is actually getting worse, and that the health of oral Australians, the oral health of Australian adults, is nowhere near as good as it should be for such a wealthy country. The reason that Australia's oral health is so poor compared to similar countries is reasonably straightforward. People simply aren't getting the care that they need. Only 39% of Australians have favourable visiting patterns. Now, what that means is that a little more than a third of the population go to a dentist as often as they should do to maintain good oral health. If you don't go to the dentist regularly, you're 4 times as likely to get an extraction as somebody who's getting regular treatment. You've got nearly 4 times the rate of tooth decay. You might have fewer teeth with fillings, but that's only because you'll have fewer teeth. The lower your income, the worse the situation gets. By almost any measure of dental health, income is a great predictor of status. The number of decayed, missing or filled teeth doubles as you go from the highest income bracket to the lowest. If you're Indigenous, the situation is even more dire. And unfortunately, that's a recurring theme when it comes to healthcare in this country. By the time an Indigenous person is in their late teens, they have 8 times the level of decay and 11 times the incidence of periodontal disease compared to the non-Indigenous population. Older Australians and people living in rural and regional areas also suffer disproportionately. If you're in an aged care facility, there's a 1 in 5 chance that you're in pain or discomfort right now because of untreated dental issues. And what this means for individuals is clear. About 1 in 6 people avoid foods due to dental problems, and a similar number experience toothache. Of course, problems with the teeth don't stay in the mouth, and there are serious complications that can occur when a chronic condition is left untreated. Oral health issues can translate into life-threatening infections. It's well documented that dental issues can complicate or exacerbate heart and lung disease, raise the risk of stroke and lead to low birth weight and premature births. Now, untreated dental disease also has a huge social cost. Like any chronic disease, the impact on quality of life for an individual can be devastating. The pain and discomfort of untreated dental disease spreads to all aspects of life. It can lead to poorer nutrition. It can lead to interrupted sleep. It can affect, for example, a child's ability to study and to thrive at school. It leads to people becoming self-conscious about their appearance. People avoid going out and socialising with others. People become depressed. Imagine going for a job interview, sitting in front of a prospective employer with your 2 front teeth missing. Imagine trying to find a rental accommodation without being able to talk properly, being too self-conscious to smile because of your poor oral health. How do you think it would affect your chances? Oral health is as much a social justice issue as it is a health issue. I want to say a few words about the history of this important reform because the Australian Greens have made dental health a matter of the highest priority. We recognise that there's nothing more important than the health of a nation. Getting dental care into Medicare is a long-term reform that will make a real difference to people's lives. That's why we made dental health a priority when we negotiated with the Labor Party over who would form government following the last election. Reform to Australia's oral health care sector was one of the key parts of the agreement we signed with the Labor Party, and we made sure that there would be significant action in this area in order for them to gain our support. And when I reflect on the agreement, that historic agreement signed between the Labor Party and the Greens, and I reflect on some of the key achievements of this parliament, action on climate change, including a price on pollution and the huge investment in renewable energy, as well as getting dental care for kids into Medicare, I think they will be remembered as 2 of the most significant reforms that have occurred in the life of this parliament, and they are a reflection of what can happen when people with different political viewpoints work together for a common cause and achieve good things. It's a testament to what power-sharing governments can achieve. Now, to advance the cause of dental reform, the Greens worked closely with the government to establish the National Advisory Council on Dental Health. The council was comprised of experts in a range of fields, a range of disciplines. We had health professionals, we had academics, people from the social services and from government, all working together, given the task of sitting down and coming up with a blueprint for reform. And they were told to focus on some practical steps in the coming budget and beyond. The final report does make a very interesting reading. It's thorough and damning in its assessment of the state of oral health in this country. And it also takes a long-range view of where we should be heading. Before setting out any clear options for reform, the Council spelt out some long-term aims. And that, of course, is sensible. There's no sense taking the first step without having a very clear idea about what the final destination should be. The Council agreed on the long-term goal of an integrated national oral health system that's part of the broader health system. They want one that provides equity of access to prevention, promotion and clinical treatment to all Australians. So the first goal of the Council identified was integrating the oral health system into the health system proper. They noted that ordinary people don't make a strong distinction between 2 kinds of medical issues. Toothache or earache, not much of a difference when you just want some relief. And separating these 2 aspects of healthcare has led to a real confusion in health policy that's lasted for decades. Just as oral health is linked to overall health, The two systems for caring for these parts of our body must also be integrated. Improving equity of access was also a top priority, and the report made it very clear that there's a huge inequity in who gets adequate care at the moment. One of the things the report made very clear was that universality is what should underpin our system over the long term. That means that no matter your income, no matter your standing in society, we should all get access to a good standard of oral health care. And I'll talk a little bit more about the principle of universality in a moment. The Council also made the point that looking after the oral health of kids is one of the best investments we could make in the nation's health. It's true that kids often do get to go to the dentist more frequently than adults, but recent declines in the oral health of kids does sound an alarm bell. Childhood dental health is a good predictor of adult oral health, and so sending children into adulthood with healthy teeth and good habits is sound public policy and a good long-term investment. Now, those of us in the public health community know that sending kids into adulthood with good habits is the most efficient way to influence their health as adults. It will pay huge dividends in the future. So, the details of this bill before the chamber, let's spend a moment to reflect on those. I think it represents an important part of the implementation of the reforms envisioned by the Council. It is the result of the focus that the Greens, I think, have brought to bear on the issue. It is part of a broader dental reform initiative. The $4 billion reform package announced in August also includes $1.3 billion in new money for public dental services administered by the states, and they're services that many low-income Australians rely on. In many cases, they've been underfunded, and for far too long we've had an underinvestment in infrastructure, and as a result we have unacceptably long waiting lists. The extra new money will fund the building of more infrastructure, chairs, will employ more dentists and pay for hundreds of thousands of additional services. The reform package also includes $225 million in new money for grants to ensure that all Australians can benefit from this package. Where there are gaps in services, particularly in rural and remote regions, this money will be available to fund projects that address areas of particular need. But the biggest part of the reform is a new Medicare entitlement for children. 3.4 million kids in families that receive the Family Tax Benefit A will be entitled to Medicare-funded dentistry that covers all essential preventative and restorative dental care at the dentist of their choice. All kids from the ages of 2 will be covered until they turn 18. Each child will be able to receive up to $1,000 in treatment in every 2-year period. So for the first time, Australian families will be able to take out their Medicare card and get dental treatment for their children just like they do at the doctor. This bill allows for the creation of the Child Dental Benefits Schedule and specifies its eligibility. The government has undertaken to consult with the profession on the range of services included. All essential preventative treatment will be covered. The Greens also agree with the members of the Community Affairs Committee, which examined the bill, that under special circumstances children should have access to more complex procedures when they're clinically necessary. And we will do what we can to advance this as the schedule is developed and implemented. This focus on children is a good investment in the future dental health of the country. It establishes patterns that research indicate will pay off in adulthood. Australia was once a leader in child oral health, but it's been slipping. The latest report on child dental health from the Australian Institute of Health and Welfare tells us that 1 in 6 children experienced pain or avoided some foods because of dental problems in the last year. Children whose parents reported difficulty. There were children whose parents did report some difficulty paying a $150 dentist bill, and they were more than twice as likely to have experienced problems as those who didn't. It just reinforces what we knew, that the health of Australian children is suffering because of the cost barriers that result from this nonsensical exclusion from Medicare. And this reform goes some way to closing that gap. It's a reform that's got the backing of many experts: the Australian Medical Association, the Australian Dental Association, the Health and Hospitals Association, and the Australian Healthcare Reform Alliance. They've all spoken out in support of this scheme. The Australian Council of Social Services recognise that it's a big step forward in healthcare equity and have praised the new reform package. $2.7 billion is allocated for the first years of the Child Dental Benefit Schedule, and over $4 billion in new money has been set aside for these reforms. It's this initiative and the other initiatives in the reform package come on the heels of $500 million allocated for dental health in the 2012 and 2013 budget, money that was negotiated with the Greens. It's the biggest reform in dental health in the nation's history, but it's just a beginning. The Greens take dental health seriously and will continue working towards a universal Medicare-funded dental scheme. A part of the scheme does involve the closure of the chronic disease dental scheme, which was instituted by the Howard government and was aimed at providing treatment to a small number of patients suffering chronic diseases. The Minister described this as one of the worst pieces of public policy that she's seen, that is the Health Minister. While we don't agree with the extent of those statements, it is true to say that the scheme was hastily designed and did contain some significant inefficiencies. It was also inequitable. It wasn't means-tested, so it meant that some people could get thousands of dollars in treatment, people sometimes who were on extremely high incomes, while others who had very poor oral health, who were concession card holders, weren't eligible for care. Nevertheless, it did provide some measure of publicly funded dental care and provided some treatment to people who otherwise would have struggled to get that treatment, and we would have liked to have seen it continue on until the start of these new reforms. We kept the CDDS running for 4 years because we wanted to negotiate something more significant in its place, something that would be fairer and be a better investment for the future, something that we could build on over time. So as part of the reform package, the $1.3 billion that we've secured for services in the public system will go some way to do that, to cover many of the people who are receiving treatment under the chronic disease dental scheme. They will now be eligible to receive treatment under the expanded services offered through the public system. But as I've said, as far as the Greens are concerned, the establishment of the Child Dental Benefit Schedule, Medicare-funded dentistry for children, is just the first step. The Greens' vision is for a universal dental scheme. Our plan, Denticare, is consistent with what medical experts say, that we need to have universality enshrined in oral health, just as we have in general health care. We know that it's a popular initiative, and most people understand it intuitively because they value their experience with Medicare. We also know that it's affordable. It's simply a matter of priorities. Now, universal dental care won't happen quickly, and it's true that to be brought in over time, we need to start with those people who need our health most urgently. Children are an investment in the future, and that's why we begin with them. But we also know that low-income earners have a high burden of disease and they need extra help. We're pleased that this initiative will make significant inroads into this problem, but over time we would like to see them become the next cohort who receive access to Medicare-funded dentistry. Madam Acting Deputy President, I am pleased that this significant reform is being implemented. It's a huge start. It's the first step towards universal dental care, and I commend it to the Senate.